move on to the most asked question folks in the group here. Where can average citizens obtain summary of healthcare report proposal? They're looking for information. Let me ask the medical professionals, 2 or 3 of you, where would you recommend they take a look at it? And let me have you stand up when you're speaking so everyone in the audience can see you.
Can you clarify that, Mr. Can you clarify the question?
Okay, where can average citizens obtain summary of healthcare reform proposals? Where can they get information on the bill?
Oh, on the bill? Yeah, and anywhere on the website, I think is the biggest ones that are on, if you were talking about from the health perspectives, there's one that, but for key things, I think Congressman Olson's site is a big resource. If you go to his site, I'm sure he'll have information on that. You want to elaborate on that? And then I'm going to say some of the other sites, as far as the doctors, you can go to the American Medical Association site. You can go to any of the professional sites of any of the academies, any specific specialties, they have that. And locally, we have Harris County Medical Society, and then state level, we have Texas Medical Association, which have information on specifically related as far as it affects healthcare and how we perceive it as affecting healthcare.
Anyone else want to add? Dr. Carter?
I'd just like to add a couple of sources of information as well. My website has certainly got a lot of information on there. We'd love to have you go there. The Republican House website is www.gop.gov, and there are many briefing papers, information papers on different aspects of the health care bill. The committee sites, the Energy Committee, there's a Democratic site, there's a Republican site. That's there. There are the trade groups, the doctors' associations, and all the different trade groups. But get out there, get the information, compare it, and then make an informed decision. And I think when you get the information, you'll see that, again, the bill that we had up there is not the right bill for our country's future, for our grandchildren, hopefully our grandchildren, certainly for our children and our grandchildren. But those sources, and please contact our office if you need something else, because we will dig and try to get you all the information.
I think, well, the Congressman Olson's site is very valuable. I'd like to say that the EMA represents 15% of physicians. The Texas Medical Association represents well over 80% of Texas doctors, and their website is very concise, easy to read, and those would be 2 great sources without having to fumble around a lot of places.
Do you have some materials here you'd like to pass out?
Sir?
Do you have some materials?
This is actually Dr. Crum downloaded HR 3200 and printed it out today. So this gives you a clue. This is it. That's not copies. That's it. And it's sitting on my desk.
Read it?
I have read a lot of it, but not all of it. I've downloaded it on my computer. And those of us involved really should be reading it because it's scary in some respects. And good in others. I mean, the whole thing doesn't need to be thrown out. Tony, did you say?
Well, I wanted to make sure I wasn't the only one, but Senator Congressman Olson knew his material, and he managed to make it through his entire presentation, and he didn't have it.
And it's so far the reason we're doing it. I just wanted
Dr. Crum, one more question for you. What's an apologist? We're going to get the door prize on this, right?
A nephrologist takes care of people with kidney disease, ICU, respirators. You don't want to see me. I take care of a lot of dialysis patients, and they do very well.
Let me ask you in the right. What's your recommendation? Where can they get information?
There's a couple of really good sites, and I try very hard to find sites that are not the American Health Insurance Plan site, which if you want to see the insurance company's point of view, or the pharmaceutical manufacturer site. The one that I particularly like is the Kaiser Family Foundation site. It's kff.org. This is one of the think tank organizations that I consider to be sort of middle of the road. And my personal politics is deeply purple, and so I try really hard to look at a very balanced approach to these things. And so there's a very nice 8-page summary if you want the short version, and then there's about a 40-page summary after that at kff.org. On behalf of the Health and Underwriters Association, there's also a nice summary on the NAHU.org site, also NAHU.org.
Very good. Thank you.